welcome back to the Q&A Files. I'm Trisha Jamison, your host, a functional nutritionist and lifestyle practitioner. And as always, I have my wonderful co-host with me today, Dr. Jeff Jamison,
Hi, everybody.
who's a board-certified family physician, and I'm so glad to have him here. So we have an incredible episode for you today. We're joined by Katee, and she is one of Jeff's patients. And she has faced intense and overlooked battle with thyroid cancer. So Katee's story is about resilience, self-advocacy, and navigating the medical system when it feels like no one is listening. So thank you, Katee, for joining us today and sharing your journey with our listeners.
Hi.
So I know she's a little nervous, but she's going to just be absolutely amazing. So we're so excited. All right. So Katee, let's take it back to the very beginning. You started experiencing symptoms in your late 20s, and you were initially told these were just signs of anxiety. Can you tell us what those symptoms were and how that affected you mentally, being dismissed so early on?
Yeah, so I started having like a little, like feeling like something kind of in your neck when you try to swallow, and you could still swallow, but just feeling like something was caught, like something was there, and just some pain in that area. And so you kind of you do get anxiety from feeling something's wrong, but that just feeling that wouldn't go away. I couldn't drink anything to help it. And the pain kind of felt like a little bit of fire going on in my neck. So I went in to seek help about that.
I bet that was really terrifying,
Yeah.
especially you can't swallow and you know something's wrong and you don't know exactly what that's going to lead to. So as someone going through these symptoms and not being believed, what impact did that have on your trust in the medical system? And how did that affect your relationships, especially with your spouse?
When keeping that question in mind, tell us what you tried to convey to the providers of care that you were talking to, and then why you felt that you weren't heard.
Okay, so when my symptoms progressed, it was evening and nighttime. So I headed to the ER, not to my like a normal doctor's appointment, because I felt it was emergent because the feelings intensified in my neck. And I was met with, when you're checking in and people looking at you like, well, your neck looks fine. You can talk okay. Nothing's caught. So then you wait for hours, and then a doctor comes in and kind of looks at you and tells you that this is just anxiety. They can tell it's just anxiety, and nothing's wrong. And you could feel something's wrong, and you kind of just feel like, what am I feeling then? There's no answers. It's just anxiety. So
So you felt really brushed off at that point.
yeah. And they gave me anxiety medication and told me to see my family physician for follow-up. So I took anxiety medications, and it did not get better.
Yeah, but wow.
And and sometimes I can't even imagine what it would be like to be an ER physician, but you do get kind of jaded. And when you do get jaded, you see, you and if a person otherwise looks like they're not going to die, or they're not going to die then in the time that they're in the ER, I imagine what a lot of those docs feel is, okay, they're not going to die. They're not going to die in my watch. They can go get some other care and everything will be fine. But that doesn't mean that that the person felt cared for at all.
Exactly.
Yeah. Okay. So now I want you to just kind of share how did that affect your relationship with your spouse?
Well, early on when it first started happening, it, it was just, well, the doctor said this. The doctor said it was anxiety. You know, you you just take some deep breaths. It was just kind of like the focus on what the doctor said and not what I was experiencing. And so not feeling like you're able to have communication and trust with someone that, you're close to, and just feeling like you're not believed by anybody that something's going wrong.
That's got to be incredibly isolating. Absolutely. Okay, so you went in, you had this experience with your healthcare provider. You weren't believed,
ER.
putting on are the ER, you now are put on anxiety medication. You're trying to share with your spouse what's real, what's really going on, and he's trying to listen to more the medical, personnel than potentially what's happening with you. Is that correct?
Yes.
Okay. So how obviously that puts some strain on your relationship. And
Right.
tell me more about that.
Well, as far as like with my marriage, the strain that
Mhm.
well, so that was a big strain we had, obviously other things in life go on, and it just not feeling trust anymore, not feeling like I'm believed, or feeling like people are attacking me. Like in in the medical community, like that's just anxiety, like brushing you off, and then it's also happening in your home. It's kind of your feelings are just all the way hurt. You can't seem to open back up.
Okay, so how did you cope with that emotional weight and the disbelief from both doctors and loved ones, your spouse?
I didn't really. I kept it all inside for a long time.
Okay.
So
Yeah.
what did you do next?
My next step, I did a week later, I actually got a large swelling on the outside of my neck. And I was visiting on the coast, and I had to go to a different ER because I had a large golf ball sized swelling on the outside of my neck a week after my initial ER encounter. And went back to the ER, and they immediately jumped to action, did scans, and then determined that it was just a goiter on the outside of my neck, and that I was in no danger from swelling towards the inside, even though I could feel it when I was still swallowing, that it was going out, not in, swelling wise, from the thyroid.
So just to be clear, a goiter is a thyroid swelling, nodule, or cyst that is detectable sometimes by just feeling on the outside, and then certainly is able to be found by ultrasound or other imaging.
Yeah. Yeah. Thank you for sharing that, Dr. Jameson. So continue on with your story. What happened after that? I found the goiter.
Yep, I came back home and saw my family physician, who referred me to a surgeon to see if it was something that would need to be treated or taken out, or what my next steps were. I met with the surgeon, and he said that, it was causing, you can have it and be fine, but because I was experiencing difficulty swallowing at times and the pain in the neck, he recommended having surgery.
And how long ago was this?
This this was in 2011. So it was like maybe 4 to 6 months from when I had the swelling to when I was able to have my first surgery.
Okay. Excellent. Okay. So then what happened after that?
I went in for I met with the surgeon. He said surgery. We went in, took half of my thyroid out, so I had a right side thyroidectomy. And waking up, he said it looked good, everything looked benign, and that I could go home and just take thyroid meds as prescribed. I was called 3 days later and said I had a cancer diagnosis now, and I needed to come back in and have the other side of my thyroid removed, which I did. So 7 days from the original surgery, I had the rest removed, and they diagnosed me with papillary thyroid cancer.
Okay, so let's talk about that a little bit. What's the difference between you? I understand there's 4 different types of cancer. I don't know if you want to get into this, Dr. Jeff,
Yeah,
and share those.
the cool thing about Katee is she has done such great research and understanding about her own issues. She can explain this
Okay,
even better than I can. So
wonderful. Okay,
I
Katee.
would love for her to talk through this because it not only is it personal for her, but it's also very educational for people in my position that sometimes don't know everything that we think we should.
Fantastic, Katee. We'd love to hear that from you.
So, I mean, so the 4 types, so there's papillary, medullary, and there's 2 other types. Right now I'm drawing a blank on, I can't remember their names. Papillary generally is not life threatening. You can live through it. They can treat you. medullary, which I have, can be life-threatening depending on how far it spreads and what different organs it goes to in your body. And then the other kinds are way more aggressive, and you don't have much time once you're diagnosed with those. So with mine, if I would have been treated right early, if you, there's different things like if you would have been diagnosed right and taken correct steps, you can prevent spread and hopefully live longer. There's also two types of medullary. There's a genetic form, and I do not have the genetic form, thankfully.
Oh, good.
Sorry, I'm drawing a blank. But I don't have to worry about my kids getting it. So it's just something that happened with me, and that's what I.
So just to fill in just a teeny bit, you talked about the papillary, which is the most common type of thyroid cancer and usually easily treatable. There's follicular is one of the other ones. It's also a well-differentiated tumor that can be treated and cured in most cases. The two bad ones are medullary, which is what you described as the one you have, which is also known as a neuroendocrine tumor, which can develop different cells and it can be inherited or it can be not inherited, which you have the non-inherited type. Excuse me. And then the worst one is called anaplastic. Anaplastic thyroid cancer is a poorly differentiated, highly dangerous tumor that can increase your chances of metastasis or spread of the disease and can be very difficult to treat and can spread rapidly and cause problems. And there's a poor prognosis.
Wow. Okay, so 7 days in between you had both sides taken out, correct?
Right.
So tell us about that. Was that so painful? What were you feeling? Was your husband with you? What was going on in your life?
Yeah. So I had young children also at the time. So the first surgery, you do small scar. They, had to go back in 7 days later. So then I had a larger scar in front of my neck, and kids in my like the children were upset because, and I didn't explain to them at that point about cancer. They were young, and just said
How old were
about 12, 9, and 7, my boys.
Okay.
So so when that first started, so knowing something's wrong, but just saying, I needed to have stuff removed in my neck. And my husband, he supported me. We both actually were smokers. Let's quit smoking. We'll be able to eat healthy, do steps we need to do together, and, get through it. However, the doctors, not my personal physician, but doctors that you go and see, oh, you have thyroid cancer. That's the best kind of cancer to have. If you are going to have cancer, you got the right cancer to have. So basically belittling the fact that I had, first of all, cancer, because they said it was the best kind and I would be fine, as far as follow up, and I wouldn't have to, I wouldn't have many changes besides my thyroid being removed.
Yeah, so I was just going to talk about that. So the thyroid cancer is often called the good cancer. Those are the air quotes, which is a misconception. But your experience with medullary thyroid cancer shows how inaccurate that phrase can be. So how did you feel hearing people like your doctors downplay the seriousness of your condition? I mean, how impactful was that?
I had a lot of anger, actually,
Mm.
outlet, and anger at the medical, people that were around me, and also towards my husband, who again was like, well, you're going to be fine. You don't have to worry about if you're going to have all these, follow-up problems from cancer, because they say, if you're going to have cancer, this is a good type. And same as my parents, everyone, I feel like everyone was trying to be positive and say, oh, you're
Hopeful.
fine. Yeah.
But
But
I can appreciate that. Yeah.
yeah, and I still had pain, but I'm like, well, then why am I having pain? Why do I still feel like something's wrong? And so by literally everyone in my life, felt like there was nobody who could understand or, was there with me holding my hand.
Oh.
they did it in their own ways, I guess. And I don't want to be real hateful towards people, but it's not what I needed. I needed people to believe me that, something was wrong, or even still have empathy for the fact
Yeah.
and the fact that, I'm going through something. And even if you think it's not as bad, the worst thing that you can have, I still had my own kind of doom in myself.
Sure. Sure.
It's never easy to have empathy for people when you don't know what they're experiencing. I mean, that's a hard thing for other people to know, but to be able to communicate it in a way that was understandable for them must have been incredibly difficult for you.
Yes. And my insurance at the time did not allow me to seek counseling or therapy. They wouldn't pay for it.
Mm, that's really frustrating.
And as I recall, you were working for a psychology outfit that will remain unnamed at this moment, but their job was psychological care for people, and yet their insurance company wouldn't allow it, which I thought was
Right.
quite ironic.
Right.
Oh, yeah. That's okay. So let's start from you are, you've had these surgeries. What I'd like to know is after years of pushing for answers, you finally received the correct diagnosis, but you still had a difficult journey ahead with repeated surgeries, right?
Yes.
So what was it like to go through so many surgeries, and what were some of the complications you faced?
So when I went down to MD Anderson in Texas, that's where I was able to transfer to because I have specialists for my type of cancer. Immediately, they said I would need to have surgery on modified radical neck. So I was cut from my ear to the front of my neck to remove lymph nodes and tissue and to get in there and see how far the cancer had spread. And so I went down, had appointments with them. They did biopsies, which insurance insisted on, even though they tested my original samples and found the medullary thyroid cancer instead of papillary. But I was able to have my first big surgery down there, and it was obviously very scary, and but happy to know that we were going to hopefully get to, you know, get everything out. Because then learning, in my original surgeries, I should have had my lymph nodes removed around the thyroid to prevent spread, and that didn't happen. So by the time I was able to get the correct surgery, it had been another 3 years, and I had spread in my neck.
Wow, that's a lot. And I'm sure, so we're going to touch on that clinic in just a moment. But before we go there, I want to ask you, obviously you had a huge financial strain.
Right.
Yeah. So when you knew that you finally found that the right treatment and you had to travel long distances and you were paying for various therapies out of pocket, can you talk about the financial toll this took on you and your family?
Yeah, flights, hotels. I was able to get for a second opinion, so I just had normal copays down there. But coming up with the money to travel, I needed a couple $1,000s, and it it was hard. I had a hard time working. I was working and my husband was working, but at that point, we were separated. And so my family, my father helped me. We were able to get the money together so I could go down the first time. And then once there learning, I think people were kind of like, I felt bad needing to go. I felt I was kind of made to feel like I don't really need to go here. I don't really need to spend this money to seek help until we went there and found out everything that was wrong. And then more people were, open to doing that, giving that help where it's needed.
Yeah.
I'm sorry, let me ask a quick
But
question.
hmm
How did you find and decide to go to MD Anderson in Texas?
So after my first surgeries, I kept having pain in my neck, and I went to an oncologist in my town and was treated there for a little while. And once they finally did a biopsy, I looked on Google, of course, and I looked on Facebook and found other people diagnosed with that kind of cancer. And there was a group that had the same kind of cancer as me. I joined the group and I started asking questions. And that's how I knew I needed to immediately get to a different hospital to get the right care to save my own life, or try to, and have the right surgeries to stop the spread. And so that group kind of held my hand, and I found who I needed to find to get me in the right direction.
So you were on Google, you were researching all the things that you're going through, and you found a community that basically pointed the way for you to
Yes.
go.
Yes.
That's incredible.
Yes.
Yeah.
So you self-advocated. You said, I don't think I'm getting what I need. I need to figure out how to get this better. And I need to advocate for myself to find the next best direction to improve my situation. Am I
Yeah.
correct?
Yeah.
And then, so did you find advocacy with other people, in your family, your community, and other caregivers that were on track with that, or they were all giving you like, oh, you don't need to do that, you don't need to go, you can get everything right here? Is that where you felt?
Yes. Yeah, I was, told they could handle the problem here, even though I was misdiagnosed for, 3-4 years at this point. My family, well, they have oncologists everywhere. Well, why so far away? You can stay here. So I didn't really have support of people around me at first when I wanted to go, but I gained the support later after we went there and they met and heard why it's so important to go to a big hospital like that to have your treatment.
And is that also where you had those multiple surgeries?
Yes.
Okay. Do you want to talk about that a little bit? What kind of surgeries you had? What did they have to take out? How extensive were your surgeries?
So those are called a radical neck. Tell us more what that means.
So that was my first big surgery in 2014. They removed lymph nodes, different tissue, muscles, and I had cancer wrapped around my carotid artery. So they went in and they were able to peel it off. It hadn't gone through the blood supply, thankfully. So they took a bunch of tissue from my neck and sent it off for testing. And after that, I was diagnosed as stage 4 medullary thyroid carcinoma because of where it had spread into the lymph nodes, outside of the lymph nodes, and into surrounding tissue and muscle. So they cleaned it up, sent everything off for testing, and then I would go back every 6 months to have checkups down there.
Wow.
Then I'd had another surgery in 2016 to go in because I had, you've got lymph node clusters all over in your neck, and they go in and clean out what they can and what they see, but others will pop up as things are in them and they get, I guess, irritated. They grow large. They can then see them on scans. So then they'll go in and do another clean out as things arise. So I had
There are also testing that lights up ones that have cancer in it. And so, and you're along the way, you had other testing to monitor enzymes and other things in your blood that would tell if there were any increases in in that activity. And so that was something that you monitored there and here in our town.
Yes. Yes, I was able to, which was important because I was able to work with my home physician to handle my regular things and pull the blood and do things that were needed by my cancer doctors that were far away.
And who was your home physician at that time?
Oh, Dr. Jamison.
Oh, Dr. Jamison. Okay,
Yeah,
perfect.
and then the extra people that I saw. And actually, I just want to say before I went down there to Texas, I had to see all these different doctors and other people that, oncology, see the surgeon, and I finally couldn't do it anymore. And I told Dr. Jamison, I can't see all these people. No one's believing me. It's too stressful on me to go. No one's helping me. And he was able to manage my care with Texas just in office. And so important to me financially because I wasn't paying copays, all these different places everybody wanted me to go. but also feeling heard by my family physician, and then only needing to go to oncology every 6 months down in Texas, far away from us, but having that relationship with my provider to understand I couldn't do it anymore and help
It's
me.
just you're being believed. I mean, obviously, you're having the surgeries. I'm sure that the nice thing about having someone that you're close to and has been following your care, he knows you.
Yes.
He knows who you are. He knows your personality, and I think that adds a lot of depth into that care as well.
Yes.
Well, and I'm sitting here a little uncomfortable as you're talking about me, but
Well, don't.
because well, I just want to state though that this is the role of a primary care physician. And this is the way it should be, in my opinion, where you can be the central hub of a complex spinning wheel of care and to be the central place where those things can come to and make sure that things are handled well. And I think that is the take home message. I think what you're saying here, Katee, is that making sure that you have a primary care physician if you're going through something like this, and lean on them, and make sure you have a relationship that you can depend on. And having that relationship can be very valuable in the ongoing and actually speeding up of care. So anything else you want to add to? I'm not trying to pat myself on the back here. What I am saying is that the role of a primary care physician is can be very central to a complex set of problems that you've had to endure.
Yeah, that's exactly what I mean, because I was ready to give up and not keep going if I couldn't just believed and listened to and go on to the next step. I was done trying to seek my own care unless someone was willing to just listen. Going, 2 doctor's appointments a week every month, all the different specialty. And everyone looking at you sideways kind of because I had a misdiagnosis, and you shouldn't be feeling what you're feeling or going through what you're going through. Little did they all know I was misdiagnosed and no one would listen.
Well, and I can tell you that during this time and when we were working through these things, Katee taught me a lot. She taught me a lot about thyroid disease. She helped me kind of focus my own study, and it helped me to be a better doctor and to listen to when people have real problems and to believe them. And sometimes it is just anxiety. But I think that even people that have anxiety can have bad problems, and you can't just overlook them just because they have anxiety as well.
And all
Yeah.
Yeah, it's hard to know where the anxiety stops and the real problem starts some days.
Okay. Awesome. Well, Katee,
Yeah,
your
well, I'm
journey.
sorry, I misspoke that. Anxiety is a real problem. I just want, I just overlooked it like anxiety wasn't a real problem. It absolutely is a real problem, but there are sometimes underlying or overlying problems that are included in anxiety. So there you go.
So, Katee, after you finally connected with MD Anderson and began receiving the right care, what were some of the biggest changes you noticed in both your treatment and in how you were being treated as a patient?
Well, patient-wise, I was finally feeling believed because I was down at a place where, they told me that, yes, this is all normal for the kind of cancer you have. And I had a plan and I had action that was happening and getting scheduled and appointments. And I felt like, okay, well, I'm being believed. And I felt kind of smug for a little while, like to everyone around me, like, well, you guys something wrong. And that also caused more problems at home because then I got more angry because I was like, see, I was right. No one believed me.
Yeah, I bet.
Yeah.
That was a big challenge.
How
So,
did you feel with, sorry, I may be getting ahead of things here, but I just wondered how you felt in the community of cancer patients.
So when I was diagnosed papillary, which was my wrong diagnosis, everyone told me, oh, that's a good cancer. It's fine. No problems. And then when I had medullary thyroid cancer, which was my true diagnosis, it was, well, you don't have to have chemo and you haven't lost your hair and you don't have to worry about radiation in your teeth. And down the line, there's different treatments for medullary, but at first, really all they can do is keep doing surgeries. And there's other, pills that, radiation treatments and stuff that they can do, but I'm not at that point yet. So then it became well, I mean, it's not the kind of cancer where you have to get sick from chemo. And so then again, well, you might have cancer, but it doesn't seem like you're ill,
It's not a real cancer.
right?
You didn't have to really go through the hard stuff, because if you really had an important cancer like me,
Yeah.
then, oh yeah, I can see how that would go.
Yes. Reach out for support groups or looking on Facebook or whatever. And I had to just only stick to my medullary thyroid cancer group, because if you just do a general cancer group, people kind of turn their nose up at you like, well, how dare you? You haven't been through what I've been through. And you haven't been through what I've been through. But there are worse and there are better. But I could support from other people in the cancer community because mine wasn't as bad as theirs. So it was hard from all different ways.
Isn't it funny how us human beings have to have some sort of competition going all the time, even in dire straits? We have to have, we have it worse, we have it better. We have this is you don't know the kind of pain I've been through, and we look for ways to separate ourselves rather than connect and communicate, which I think is a sad commentary on kind of humanity.
Yes.
Yeah, definitely. Yeah, thank you for sharing that. Well, I was just curious, how were you feeling at that time?
Why
Symptoms
are
were you having?
Symptoms?
Yeah, yeah. How were you feeling? What were your symptoms? What was going on with you as far as just were you really tired? What were you struggling with?
Yeah, I had a lot of tiredness and brain fog, as it's called, because I had my thyroid removed and I was on thyroid replacement. And for a while after your thyroid gets removed, they play around with med levels to see what your body needs and how you respond. So, if you're too low or too high, you can have hair loss or racing heart, cold intolerance, heat intolerance, which I had all of those things at different times while trying to get my meds in line. And I also had a large scar from my ear down through the front of my, which I, I was keloiding. So I'd have to get injections into the scar.
Oh,
I
I bet
think
that was painful.
that steroid injections, or I don't know what it was, but yeah, to help stop the growth of the scar because it tightens up your skin and neck. So just physically, it was those kind of things that I was dealing with. And then, neck soreness. I had some tissue taken, that side, my shoulder was tight. So some therapies and lymphatic drainage I had to learn how to do because my lymph nodes weren't removing fluids as they needed to. So you have to learn different, things with follow up.
It seems like you also had some GI complaints with that as well at that time.
Yes, I did. I had a lot of problems needing the bathroom, finding out where a toilet was all over my town. Anywhere I go,
Yeah.
a lot of problems. And I
So,
still in my neck, the pain from, just the muscles being tight, all the surgery sites, all of that.
so how long did things take to settle down?
So from physically, I had my first big surgery in 2014. It kind of starts settling down after a year. And then in 2016, I had to go in and clean it out, do it again. Takes about a year. Well, then 2021, I had another surgery and I had my recurrent laryngeal.
Laryngeal, threat laryngeal nerve.
Yeah, so I had cancer wrapped around that and they thought they could peel it off. This time they couldn't. So they had to cut it on both sides and they, fused it back together and tested it. And before they closed me up, they thought everything was working, but I did end up with a paralyzed vocal cord. And so I had to do speech therapy. And then I had a lot of, nerve pain after this last surgery. And so it's been 3 years, but I still have problems with my speech. I have, like, if I eat a salad, I'll choke on lettuce because things don't function right inside my throat now. So I constant follow up with speech, and again, back to feeling like there's something there that I'm going to choke on all the time in my throat. So it's never ending. Learn to manage the symptoms and the problems that come from it. And it just takes, finding the right providers, I guess, to help you through it. I found a good therapist, and she was able, did have a whisper voice. I wasn't able to project at all. And working with her, I'm almost back to where my voice was before surgery, and my vocal cord is still paralyzed. So
Are you in any kind of therapy right now?
I was finally able, after I got on just my husband's insurance, I was able to start therapy for my mental health. So for the past couple of years, I've weekly in mental health therapy, and that's the only therapy I'm doing right now.
Has it been helpful for you?
Yeah, been having EMDR, and it's always, and they kind of force you to unpack and work. But it's hard.
Yes, so good though.
It drains you, and you're tired, and you get like, man, I feel like I'm sick, for a day or two after. But I didn't used to be able to sit here and have a conversation about my cancer history without falling apart or just not talking. It was too hard. Now I can.
Well, excellent. Yeah, that letting go thing is really powerful. Yeah, very good.
It really puts your body on flush, though, doesn't it? I mean,
With the
it
fire.
clears and it creates the kidneys to really kick in, and so urine is just a heavy flow for at least 8 to 24 hours after EMDR. And by the way, it's a rapid eye movement therapy that is especially good in helping people heal from traumatic events.
Yeah,
So that's what EMDR is.
huge for trauma. Mm-hmm. Excellent. So looking back, Katee, is there anything you wish you had known earlier in your journey that might have changed how you approached your diagnosis or care?
Looking back, well, at that time I had young children. I wish someone would have told me to get my children. I'm going to get teary now, to get my children in therapy. I was really young when they finally found out what was going on, and I was struggling. I ended up getting a divorce. And so my children were kind of in an upheaval of their own lives. And I wish I would have, trying to work full time, my kids in school, deal with my personal health. I wasn't able to get my own kind of counseling when I was first going through all of this. And by the time I was able to get a grasp on it for myself, my children were, I had a couple children who, one especially took a wrong path and kind of had a real hard time in his life, the bad choices. And it was hard because I needed therapy for that too, because my son was rejecting me, didn't want to be around. It was hard for him to even look at me with my huge scar and the things that were, going on at home. Like, he didn't want to face it himself.
How old was he at that time?
He was 12 when it started, and when he became 14, 15 is when we really had a lot of family dysfunction going on, because that's when my divorce happened and my major surgeries. When I had the first major surgery, we kind of had to sit down and tell the kids what was going on, because, we once you hear, you're stage 4, you don't want to just, you don't know what's going to happen. So you kind of have to just be honest, like, and tell them. And so we did. And that kind of, I wish I would have been able to tell them in therapy with help. So that's something to look back on. And also my husband, we did get a divorce. And I guess now I can look at it like, if a doctor is telling me, nothing's wrong with your spouse, and your spouse is saying something's wrong, it's kind of like they're caught in the middle too, and so I'm able to have empathy for him and what happened then. And I wasn't able to back then. I wasn't able to look anywhere but myself.
Well, you're in crisis.
Yeah.
So you're in that survival mode for sure.
So what happened with him?
We got a divorce. We stayed living together because we got the divorce and we hadn't moved separate from each other yet because we were waiting financially to, we were only renting at the time. So we were waiting. And then I got the call that it was stage 4. And he said, well, I'm not going to move out. And I said, okay. And he's like, well, just figure out getting through this. And so we ended up reconnecting, and we were able to, him coming with me down to Texas to hear from those doctors and hear, it probably helped him hear, your wife's not crazy and just making things up. And I was able to look at it from another perspective as well. So we actually got remarried. And
Wow, that's awesome.
yeah, so it's a happy story in the end, but in between there was a lot of
Oh,
lot of
my gosh, I can't even imagine.
yeah.
That's just, wow, that is a really hard story, but just like you said, what a happy ending, I mean, you're still going through it, of course, but I mean, just you've got the support that, yeah, that's a great part of that. I love that. So,
But you also know, I think one of the things that's important when it comes to these kind of relationships, when people are in crisis, that if you can figure out a way to maneuver through it, you will grow stronger together because of those things. It's kind of like going to war together with a person, or they're going to be somebody that because you went to war with them, or you went through this strife with them, that all of a sudden you become closer, and you can relate better to each other because of the experience. Would you find that to be something that helped you, Katee?
Going through the experience together, yes. I think it helped him as well. I mean, learning more about, and we were young, and it's been years now, and learning how each other handles crisis as well, and how different people react. But yeah, coming out stronger because we did go through all of that together. And now when something's up and something's wrong, I'm able to clearly say, hey, well, I know something's wrong and it's okay. And I have no fight about like our finances and continuing to go to Texas for my follow-up care, because it does put a strain on our finances, but it's necessary and we both know and believe that it's necessary now. So, it's
So you feel more prepared.
yes.
well, and you've got that support that you didn't have before. So that's got to be so, such a different feeling now that you didn't have before.
Yeah.
Mm.
Yep.
Okay, great. So with all that you've gone through, how have these experiences changed your perspective on health and your well-being? And what does it mean to you now to have a healthy life?
So the first part of your question, tell me that again.
Yeah. So with all that you've gone through, how have these experiences changed your perspective on health and your well-being?
Well, I mean, my experience on health, well, I feel like we should all strive to be healthy, but the healthcare field, there's a saying in my medullary cancer group is you got to drive your own bus, and you have to really be clear. And if you're with a doctor and you're seeing somebody and they're not standing up to your expectations or listening, it's okay to say, we're not a good fit and I need to find someone else who is. And it's okay. And I don't mean like just go around and doctor shop, but if you're somewhere and you're trying to work and get healthcare and you're not being believed, it's okay to ask for a second opinion, and it's okay to take a step back and go somewhere else if you feel like you're not being treated correctly. And I wasn't able to stand up for myself in the early days.
That is clearly not the problem anymore for you.
Well, you don't know what you don't know.
Right. And it's been really fun for me to be a part of this process, because I've been able to see the growth that's happened with Katee, and to be able to see her go from somebody who just, basically took whatever a person said as face value and moved from there, to someone who comes with an agenda to an appointment. She's prepared when she comes. If she needs certain paperwork filled out, she's got most of it done beforehand. There are things like that, that if you are really trying to maximize the time with your physician or whatever caregiver that you're working with, I think there's a whole bunch of things that Katee does that has helped her gain her direction and to be able to get where she wants to go. How do you feel like you have changed yourself to be able to be prepared for those appointments?
Great question.
So I would show up to appointments just looking at, like waiting for them to tell me what's next, or waiting, like come back for a, 3-month follow-up, and you go there and look at each other and no, no one has anything to say. Well, your blood work looks okay, or, oh, we're going to do this scan or anything else. And nothing gets accomplished, and you feel like nothing's accomplished. So I feel like when you're going in, I'll done research, or if something's going wrong, if you go in saying, and with any form of health, not just with my cancer, like, hey, I'm having these pains and I'd like to get my gallbladder a gallbladder scan. Turns out I needed it, and so things like that, like, here's my symptoms, being clear, here's my symptoms. I'd like to know if we could, do some tests, or I'd like to know, this clearly stated what's going on and what's going wrong with you.
And then being proactive about it
Yes.
and saying, okay, what are the options? What can we do to work on this? And having some ideas in your mind already of what you're thinking. That has helped me. Like I've said before, Katee has taught me so much about how to be a better doctor by her personal study about herself, and for me to be able to follow up on the things that she said. The other thing is that develops as you work through these things as a physician for me is the ongoing development of trust. And when you can trust a person, you don't immediately think, oh, it's just anxiety, it's all in their head. And I'm sure that people feel like that a lot with their caregivers or their providers. And that's something that I never want anybody to feel like when they come to see me, but it still can happen. So having that trust, though, develop because you've done your job and helped me do mine. That it is incalculable how much it improves those contacts.
Yes.
So, so good. We have a daughter that has had some very challenging diagnoses, and we have found ourselves in your position, and not knowing exactly how to help her, what to do. And she just has a myriad of so much going on with her. And sometimes I don't think she is believed by physicians either. And so it has been it is really hard. It's frustrating,
And I think that sometimes physicians, when a person comes in with varied and a lot of different issues, that the physician or nurse practitioner or whomever, they get overwhelmed.
Sure.
You get overwhelmed. You've got so many pressures. You don't know what the pressures are that are of the provider that's coming in to sit down with you. You don't know how many patients are behind you. You don't know how many patients that are that is somebody else waiting in the room next to you that is really upset. You may have just come from telling somebody that they had new cancer, and then you've got to go see a new baby, or there's all kinds of different stressors that happen on the provider themselves. So when you're prepared to go into an encounter with a provider, a doctor, nurse practitioner, PA, whatever, making sure that you know what's going on with you and be able to articulate that ahead of time. And sometimes that be writing it down, having specific questions, and then sometimes even giving those questions to the person who comes in so they can look them over ahead of time. Because if you've got 10 things down, very likely 2 or 3 of them all relate to each other, and you can kind of clump them together and make them all go away quickly. So, and that's one of the things that I've learned from Katee is that she comes prepared. It's like we had an appointment just recently, and there were things that she was concerned about, and I think that we communicated well. What do you think, Kate?
Yes, we definitely do.
No.
Is I have a symptom of something. These are the things I looked up, and I would like to know if we could test that. And yeah, it's very smooth. And my early appointments were like, well, I have diarrhea, my neck hurts, I'm having nausea, all over the place. And before you know what's going wrong, and you're coming in with 27 symptoms, all of it side effects from my cancer and the numbers being thrown off into my blood. But at that point, we didn't know what was wrong. So everything, I'm disorganized. I go into an appointment, something's wrong. All these things are happening. That's something I've learned is I can't expect one provider is going to be able to just snap their fingers also and know what's wrong with me. It does take time. And so having empathy for the patient, but also being able to look at the provider and say, it's okay to not know what's wrong. And can we work together to fix it? And being able to trust that that provider is going to listen and take you along and let's figure it out.
So what's a key
So well
tip
said.
that you can leave with listeners with what you just said? What's a tip that you could share with them? What you share right now.
Just being upfront, honest about what you're looking for out of your appointment.
Okay, you're writing things down.
Yes.
Excellent.
And being ready and organized.
Mm-hmm.
Huge help. I can't tell you how many people come into my office and say, well, I need this paperwork or that paperwork, and then they don't bring it. And it's like, well, how am I supposed to do that? Because what they figure, what some people figure, and I know you don't, Katee, because you and I have been working together a long time. But what they figure is that, oh, well, I'll bring it in a couple of days. You can get it done and back to me in a half hour. Like you have nothing else to do but whatever they need you to do. And so having those things prepared and be ready at the time of the appointment, chances are you're going to get them taken care of and be done with at the time of the appointment.
Yes.
Well, and I really like this because I think so often we forget what the physician has on his plate, her plate. And so just like Katee, she's being very respectful of his time by making sure that she is prepared. She's got things written down. She's looked up things to ask the most pertinent questions. So I think that those are really key things to really think about and focus on.
And I think
Awesome.
some
Thank you.
doctors are intimidated by patients that do their own research. Oh, I looked up on Google and this is what I found. Don't let that discourage anybody from doing your own research,
Dr. Google.
because sometimes the Google things are great and sometimes they're not.
Yeah.
But you can easily sort through those things when you sit down together. But don't let it keep you from doing that, and don't let the ego of the provider discourage you from doing your own thinking. That's okay.
Yes.
Excellent. So, Katee, what motivates you now to keep going, especially on those tougher days?
Well, after getting remarried, my husband,
We just love this story. This is the true love story.
we had a daughter and she just turned 5. So that gets me out of bed. And when I was in the depths of all of this, I got a couple cats actually. And not really, I had to get up and take care of my cats. I got myself something, my boys, they'd be at school, but at first I was just, I need something that, cats will love you and not talk back to you. So that kind of helped me being able to do something all day long, and the kids as well, to kind of focus everyone's attention. And so that really kind of helped us. But as far as now, I'm in a better place with my marriage. I'm in a better place with my kids. I mean, everyone's grown up a little bit, and
So just gonna ask that question.
yeah.
Mm-hmm. Nice. Oh, good. Okay.
And thank you for letting me be a part of this journey with you. I've thoroughly enjoyed it, even though times have been difficult, for you especially as we've gone through it. But wow, what a great experience for me as your physician to be able to walk this path with you and to be able to support you in ways that I could. But I'm also sad when I can't fix everything immediately. Who doesn't want to do that? But
Yeah.
you've just always been gracious, and I appreciate that.
Thank you.
You guys look like you're a really great team. So that
We
That
have been
makes
a great
sense.
team.
Fabulous. Well, great. So Katee, have you guys had family counseling? Were you able to get that extra support?
I just took myself. Insurance doesn't pay for family or marital counseling. So I just started taking myself to therapy and working through what I needed to work through. And something important that my therapist told me is I have to work on myself separate. And so my husband would need to work on his self, but you can't just throw two people into a marriage counseling and think things are going to get better. You have to do the work individually as well. So that's what I've done personally is just my weekly sessions with my therapist and working through my own feelings and emotions of everything and going forward.
Yeah.
That's
Excellent.
awesome. And lots of hugs.
Thanks.
So, as a last question, Katee, what message would you like to leave our listeners with, especially anyone who might be in a similar place, feeling dismissed or lost in their health journey?
Keep asking questions. I just kind of laid down and let them make decisions. Like I had things I didn't need to have happen to me, like radioactive iodine that I never needed because that cancer, them telling me I had a certain kind of cancer and treating it with certain things wasn't right. And I felt like it wasn't right, but I just did it anyways because that's what they told me to do. So always, it's okay to ask for second opinions. And I think everyone should always get a second opinion, even if they're told by a doctor, hey, this is exactly what it is. If it's something really scary like that, I recommend everyone get a second opinion and then you're able to sort through the different information that you're given.
Fantastic. So, Dr. Jeff, is there anything that you would like to add?
No, I think I kind of interjected as I went along, and I'm entirely grateful for Katee and for the time that she spent with us and the insight that she's given. And like I said before, I have learned so much from my association with Katee over the years. And I think that we've been a good team. So that makes me happy. But at the same time, you know, it's those kinds of trust relationships that build the best bonds and the best teamwork for getting through healthcare issues.
Fantastic. Well, Katee, we just want to thank you so much for sharing your story with us. Your resilience is absolutely inspiring, and your courage to keep pushing forward is something that will resonate with, I know, so many of our listeners. So, for those of you listening, if Katee's story resonates with you, please reach out and let us know. We'd love to hear your thoughts and connect with our growing community. So, if you enjoyed today's episode, please consider leaving us a review and share it with your friends and family and allow us to continue growing this community of listeners who support and uplift one another. So, if you have any questions about health, relationships, medicine, or personal story you feel could help others, please don't hesitate to reach out and ask your questions. So, please send them to Trisha Jamison Coaching at gmail.com, and we'd love to discuss your question or perhaps even have you on our show today. So thank you so much. And again, thank you, Katee. And we will see you next week. Bye, everybody.
All right.
Bye.
Thanks, Katee.